Well, we've learned over the last several years that CDK4/6 inhibitors have really revolutionized the outcomes for our patients with metastatic hormone receptor positive disease. But knowing that there is such an improvement in outcomes for the metastatic patients, there's been a lot of interest to see if we can use CDK4/6 inhibition in the early disease setting to try and prevent recurrences. And so there have been a number of trials that have been conducted looking at CDK4/6 inhibitors in the early disease setting. And I think we've seen some conflicting results, which was certainly part of the focus of the symposium. So what we learned was that the monarchE trial, which looked at 2 years of adjuvant abemaciclib in patients with high risk hormone receptor positive HER2 negative disease, did result in a significant improvement in invasive disease-free survival with about a 30% reduction in invasive disease-free survival events, whereas both the PALLAS and PENELOPE-B trials did not result in a benefit from the use of adjuvant Palbociclib. And, I think this is confusing to many because we've seen pretty similar efficacy benefits in the metastatic setting, looking at Palbociclib and Abemaciclib, and now we're seeing conflicting results in the early disease setting. I think some have tried to explain this by saying that maybe Abemaciclib is a more potent inhibitor of CDK4, and maybe it's the fact that it's dosed continuously. Maybe it was a higher risk patient population that was utilized in monarchE. Maybe it was a shorter duration of Palbociclib used in PENELOPE-B, or the high discontinuation rate seen in PALLAS. So I think we've all been struggling to explain these differences. But I think overall, what we now know, at least at this time, is that Abemaciclib does seem to have a benefit in preventing recurrences. But I think we're all very eagerly awaiting longer follow-up data from monarchE, particularly because it was the last presentation, the primary outcome data came out with about 19 months of follow-up. And so it'd be nice to see what happens with longer follow-up, particularly after Abemaciclib is discontinued in the majority of patients, to make sure that that benefit is maintained.